Hello everyone. Now let us discuss about warm antibody mediated autoimmune hemolytic anemia. To understand more about it, first let us look into classification of acquired immune hemolytic anemias. There are basically three types: autoimmune, alloimmune, drug induced. Autoimmune hemolytic anemias are again three types: warm antibody mediated, cold antibody mediated, and PCH. PCH means paroxysmal cold hemoglobinuria. Warm antibody mediated is IgG type. Cold antibody mediated is IgM type. Now moving on to warm antibody mediated AIHA. We already know that warm antibody mediated AIHA is IgG type and it is more common than cold AIHA. It is more common than cold AIHA. Females are more affected than males, and in this we can find moderate splenomegaly. When peripheral smear is done, we can find polychromasia, that is different colored RBCs. Then we can also find spirocytosis, and we can also find fragmented RBCs. And moving on to pathology of warm antibody mediated AIHA. First of all, IgG antibodies attack RBCs, and splenic macrophages has receptors for Fc portion of IgGs, and so IgG antibodies are trapped by splenic macrophages and RBCs are destroyed, and it shows subacute presentation, that is presentation within few weeks. Optimum temperature for these IgG antibodies is 37 degrees Celsius. What are the symptoms of warm antibody mediated anemia? They are significant anemia. If significant anemia is present, it shows pallor, weakness, dizziness, jaundice, dyspnea, fever, and sometimes it can also show symptoms like palpitations and high colored urine, that is dark colored urine. And if the patient is suffering from warm antibody mediated AIHA, then positive direct antiglobulin test, DAT test, is positive. Now moving on to causes of warm antibody mediated AIHA. Causes are basically divided like primary and secondary. Primary causes are 50%, and 50% of cases are idiopathic, means cause unknown. And secondary causes of warm antibody mediated AIHA is like SLE, rheumatoid arthritis, polyarthritis nodosa, IBD, that is inflammatory bowel disease, CLL, HIV. Drugs also, few drugs also cause warm antibody mediated AIHA. They are methyl-dopa and ceftriaxone. Now moving on to treatment. Treatment includes oral steroids and low-dose rituximab. And if relapse occurs, one can prefer splenectomy, and if the patient is unwilling for splenectomy, then such patients have to be given high-dose rituximab with cyclophosphamide. Thank you. Have a great day.